Welcome back to the Vaginoplasty video series. My name's Fatemi, my pronouns are she, her, and we're gonna talk about post-op information today. If you haven't watched our first video, go ahead and check it out in the description. Otherwise, let's get started. Number 25. The pain that you'll feel when coming out of anesthesia can be likened to being tucked for too long. If you don't know what that feels like, everyone watching this video is jealous of you. The exact flavor of pain you'll feel after the anesthesia fully wears off, though, cannot be completely predicted and will be unique to the idiosyncrasies of your body and the exact moves that your surgeon made. Number 26. After the surgery, you will probably find that there is roughly 4.7 times 10 to the power of 13 cubic light years of gauze stuffed within your newly minted vagina. This is called the packing. It keeps your vaginal canal open for business, or healing anyways. It will probably be sewn into you so that it doesn't fall out. In fact, it will probably be sewn into your inner thighs, which can make mobility a bit difficult. Unfortunately, as the days go on, the packing will start to smell progressively worse and worse. I have never found the right words really to describe it, but I can tell you it smells pretty dumpstery. Luckily, it only really has to be in for about 5 to 7 days, and after its removal, you'll probably notice an overall drop in your pain levels. Number 27. Your surgeon might put a wound vac on your surgical site. This is essentially a pump attached to a tube that puts constant negative pressure on your vulva. If your surgeon elects to do this, note that it might be painful, but it does generally reduce the rate of complications. Number 28. Because of the packing, stitches, and general level of medical supplies in and around your vulva, you'll probably not be able to get a good look at it for at least a week or two. The waiting can feel like an eternity, but just know that you do have the rest of your life to admire it. It's also good to note that the amount of swelling you'll be experiencing in the first few months will make your vulva look different than it'll look later down the line. This swelling is of course temporary, and your vulva will settle into its final appearance within about a year. Number 29. If your surgery takes place at a surgery center as opposed to a hospital, you may be discharged from said surgery center a couple hours after waking up and taken to a rehab facility. This facility is where you might eat your first meal post-op, and it'll also be where you get used to what the healing process will be like. If everything looks good after a couple of days, you will be discharged to your lodging. The packing and catheter might be removed at the rehab facility, or it might be removed at a post-op appointment later on. Number 30. You may have to get used to sleeping on your back, at least for a few weeks. It is literally just the least painful position to be in. And yeah, I know, I also kind of hate sleeping on my back. But pain is a pretty good motivator. Number 31. Depending on your circumstances, you might be prescribed some pretty strong opioid painkillers. They might make you itch, and they might also make you sleep for longer periods of time than you normally would. For the itching, I used over-the-counter diphenhydramine, and that combated it pretty well for me. As for the sleeping, I think it's for the better. The first week or so of healing is by far the most boring and painful, so I'd say you're not missing much. Number 32. Your surgeon might recommend that you put a bag of ice on your vulva in order to help with pain and swelling. Try to make sure the bag doesn't leak, because getting your dressings wet can increase the possibility of infection. Number 33. Eat. Your body needs fuel in order to continue healing. Something that might be helpful is to ask your community for food that you can put in the freezer and then heat up in the oven as you need it. You might even be able to organize a meal train. Number 34. Drink. Specifically, drink water or other liquids that don't have a lot of sugar in them. Sugary drinks might cause a crusty buildup in the tube of your catheter, which is not fun to have to deal with. Keep in mind that staying hydrated will in fact mean that you have to empty your catheter bag more often, but it's better than the alternative, i.e. dehydration. Number 35. Your catheter will save you from having to get up to pee, which is very convenient if you want to hang out in your bed for extended periods of time. However, your catheter bag will have to be emptied by either you or your helper at multiple points throughout the day, including at 3:30 in the morning or whatever other time is least convenient, and having your catheter in might feel a little bit uncomfortable, just so you know. Number 36. The removal of your catheter will likely be followed by a test to make sure that you can actually urinate without it. Your surgeon might fill up your bladder with a little bit of saline and instruct you to pee into a hat to see how much comes out. If you've had your catheter in for a while, you might actually have forgotten how to pee, which is definitely an odd sensation. But if this happens to you, don't worry. Just turn on the sink so you can hear the sound of rushing water and maybe even think of waterfalls as you're sitting and trying. You might find it easy to get started, or it might be difficult. It might even feel too easy, and that is okay. The actual physical sensation of urinating might also feel different now too. This might mean that it hurts more because of the freshness of the surgery, or it might mean that there's just less sensation overall because there are still nerve endings that need to reconnect. In any case, this will probably all mellow out within a couple of months. Since this is your first urination with a new body part on the toilet, it might take a minute to figure out how to position your body. A good place to start is to lean slightly forward, but you might have to adjust from there. Number 37. Wiping may be difficult at first because it's a new thing to learn, and you'll probably still be in pain. You might want to kind of dab at it at first because that'll definitely be less painful than dragging toilet paper across your new vulva, but as you heal, you should probably transition to doing an actual front to back. Getting your arm behind your leg might help with doing this right, and if you don't already stand up while wiping, you might find that that works too, but everyone's a little different. Number 38. On a semi-related note, depending on the dosage and idiosyncrasies of your body, you might find that the opiates you're given will cause monumental constipation. You might even be taking some laxatives at your surgeon's behest, and they might feel like they're taking forever to kick in. One day though, it'll finally be time to experience some much needed relief. In order to avoid strain on your gut, and thus strain on your stitches, it's best to wait until you really have to go before you go. Number 39. The removal of your packing will likely be gory. It has spent a while soaking up all the blood and gunk from a major surgery after all. Be prepared for the ultimate clown-pulling scarves trick, now in crimson red. Number 40. The consequence of having your packing removed is that it will no longer be able to soak up all the blood and gunk from the major surgery you've just had, and you will likely be bleeding quite a lot. This will be your first and only period. I would say enjoy it, but unfortunately this is something only considered to be enjoyable by the sponsor of this video, no one. Believe it or not, dealing with blood being expelled from your vagina for the first time is inconvenient, messy, and uncomfortable. Luckily, there is already a $40 billion industry dedicated to soaking up blood expelled from vaginas, so get yourself a nice big box of heavy-duty pads. It's also a good idea to get a box of overnight pads for, well, overnight use. These are longer and thicker, so they account for all the different ways you might shift while you're sleeping, so you don't get bloodstains on your underwear or your pajamas. A 30 pack of each type of pad should suffice to start out with, but err on the side of more rather than less. Better to have them and not need them, you know? Number 41. To apply a pad onto your underwear, first make sure that your underwear is pulled down to a little above your knees, and then open the package of the pad. This specific pad has the outer packaging connected to the adhesive backing, so we'll remove both of those pieces in one motion. Make sure to hold onto this packaging for later, by the way, when you're ready to remove the pad. After this, we'll place it into the center of the crotch of the underwear. You'll get a better idea of how far forward or backward to place it after you've worn a few pads a few times. The wings of the pad should more or less coincide with the least wide part of the crotch of the underwear, since they'll be wrapping around the outside of the underwear to give the pad some more stability. Peel the adhesive off these wings and smush them inwards onto the outside of the crotch, and then pull your underwear snugly onto your body. When the pad has been saturated with blood and you're ready to change it, remove it by grabbing the least soaked end to rip it off the underwear. Then fold it up and cover it. If you still have the wrapper from this pad, you could use it here. Otherwise, you could use either the packaging of the next pad that you're going to be wearing, or toilet paper. When using toilet paper, make sure that you position the pad sideways and then wrap it up like this to prevent leaks. After covering the pad, make sure to dispose of it in the trash can and nowhere else. Number 42. It is a time-honored tradition to wear your least favorite underwear while bleeding. You could even get a pack from a store specifically for this purpose. Number 43. If you do get blood on a nicer pair of underwear or a piece of fabric that you care about, ask one of your friends who does bleed every month how they get blood out of their fabric, because there are like 20 billion ways to do it. Here's one way to do it. Take equal parts hydrogen peroxide and water, mix them together, then get a Q-tip and rub the affected area with that solution until the stain is mostly out. Then throw it into the wash to finish the job. You should probably try to do this when the blood is still wet and not after it's dried. Just a little tip. Number 44. After you stop noticing blood on your pads, you may elect to continue wearing them and changing them indefinitely due to the gratuitous presence of heavy, thick, opaque, fragrant discharge. Don't worry, it won't be this opaque and fragrant again, but it will take some time to mellow out. Until then, the pads can block the odor and absorb the moisture. You might also choose to transition over to using panty liners because these are less heavy and they're also a little bit less expensive. Number 45. Your surgeon may require that you douche once you get the packing out. Douching involves sticking a long insertable nozzle from a pre-filled bottle that you usually get from the pharmacy and squirting an acidic solution of water into your vagina. Personally, I can see the utility of douching earlier on because there is actually stuff in there to clean out, but I've yet to meet a gynecologist who thinks that it's a good idea to do long term. We'll have a more nuanced discussion about acidity and pH in general later on in this series, but for now, I'll just say this. Don't get the scented ones, just keep it simple. You're going to be blasting a pretty raw area with this stuff, so the fewer random chemicals, the better. And after all, a vagina is supposed to smell like a vagina. Number 46. Crouching down to pick things up off the floor will be pretty difficult for a while, especially before you get your packing out. This is because the act of crouching stretches out your undercarriage, which can be understandably pretty painful if your undercarriage is currently being held together by staples. Number 47. In your early recovery, laying down will be by far the least painful and least uncomfortable position to be in, as stated previously. Standing up will actually be the second least painful position to be in, followed by sitting on your butt, followed by sitting in any way that stretches out your undercarriage, such as sitting on your knees or crouching. Number 48. Post-op depression is real, and quite common in fact. You may just feel bad or experience emotional upheaval for the first month or so after your recovery, and the fact that you might experience this does not necessarily mean anything about your decision to get the surgery or about your transness. You might also feel pressure from trans and cis people alike to immediately feel better after the surgery, or immediately have all of your bottom dysphoria evaporate into thin air. But that sort of instantaneous timescale just doesn't work for a lot of people, and that is okay. Post-op depression is just a thing that happens after any given surgery, whether that surgery is gender affirming or not. Something you can do ahead of time to try to take the edge off post-op depression is to make a schedule with your friends to know when they'll be visiting you or calling you, so you can always depend on that social interaction at a specific time of the week. Whatever other routines that you had prior to your surgery, I recommend keeping them up as much as you realistically and practically can. If you're the kind of person who wears makeup every day, I say throw some on every day. If you're the kind of person who goes on walks all the time, I'd recommend starting small after you get your packing out and then working your way up. And if you're the kind of person who takes a shower every day, I recommend managing your expectations. Number 49. Speaking of showers, you will not be able to shower normally for at least a week after your surgery because your dressings must not get wet. As stated previously, this is because wetness can facilitate infection, and that's the last thing you want when you haven't even gotten a chance to have fun with your new vagina. Instead of taking a full-on shower, or God forbid, a bath, try just washing what you can over the bathroom sink, using as little water as possible, and taking care to not let anything drip towards your crotch. This can be kind of a difficult thing to pull off if you're feeling especially weak, so this is another thing your helper could possibly do. And if you're not close with your helper right now, you're about to be. Number 50. At the point that you do take your first real shower, you might still have some staples and stitches in your vulva. This is one reason why you might want to stay away from loofahs and sponges, because getting your cleaning device stuck on one of these staples or stitches really does feel like getting your soul sucked out through your vagina. Number 51. Laying in bed for a week or two is sure to contribute to a sense of weakness when you get back on your feet. Getting pushed around in an airport wheelchair might be necessary for your ride home. Number 52. Prepare for boredom. As fun as scrolling and watching TV can be, they can also get pretty old pretty fast. Even watching TV with someone else can be nice. Anything beats passive solitude. If you've always wanted to learn how to play acoustic guitar, classical guitar, or ukulele, this is also the time to do it. Those instruments are very easy to play while laying down. If you've always wanted to organize every photo in your phone into a different album, you can also do that now too. And other activities could possibly include online shopping, reading that book you always said you'd read, journaling about how you were feeling, and of course, memorizing pi to the 322nd digit. This concludes our post-op section, numbers 25 through 52. In our next video, we'll be talking about dilation. We'll see you then.